effects on the physiology of the body lah. We have increased heart rate, respiration rate, and blood flow to the muscles. At the same time, we have decreased GI functions and also causes capillary dilations. Most of the neurotransmitters actually involved. We have the ACH, the acetylcholine, epinephrine, also norepinephrine lah. They are all of these neurotransmitter involved lah. Same as parasympathetic, which is the cholinergic system. Cholinergic system actually homeostasis, brings back everything back to the normal level lah. For example, after after you like for example run very fast. You stop. That's when your parasympathetic wave kicks in. It brings heart rate, respiration rate, and blood flow back to normal level. Returns the GI functions to normal, and also constitute normal. So they are actually to return back or with everything back to its normal physiological functions lah. So autonomic nervous system drug can work either by acting like neurotransmitters, or by interfering with the neurotransmitter release lah. There are two mechanisms in which they affects these systems lah. We have two groups of drugs which affects the parasympathetic nervous system, and also we have group of drugs which affects the sympathetic nervous system. The first one is actually the cholinergic drugs. Cholinergic drugs is actually what they do is actually they mimic the actions of the parasympathetic nervous system. That's the function of this group of drugs. We have betanicol, metoclopramide, pilocarpine, bromphenium, neostigmine, imiquimod, and also organophosphates. Organophosphate is actually not really a drug. They are more like toxins or poisons normally used as a used to actually kills off weed and stuff like that for agriculture use lah. Organophosphate is actually one of the during again I tell you about another condition that happens during another things from Vietnam War lah. During the Vietnam War, most of the soldiers when they come back from their duty over in Vietnam, they actually suffer a lot of this parasympathetic nervous system syndrome lah. It's because what during that time when they wanted to actually one of the chemical or biochemical weapon used during that time actually the use of DDT lah. DDT is a poison. Normally used as for weed control. And one of the active ingredient in DDT is actually organophosphates lah. So when they use that kind as a biological warfare, most of the soldiers when they come back, they actually suffers some form of this cholinergic, so some of this parasympathetic nervous system syndromes lah. I'm going to actually discuss two of the most common cholinergic drugs used lah. We have the betanicol and also the metoclopramide lah. Others are actually also used but not as intensive as these two lah. So for betanicol, actually it directly stimulates the cholinergic receptors. So they actually have resistance towards bicholinesterase. Cholinesterase is actually an enzyme for the neurotransmitters like acetylcholine to actually act. They have to be actually metabolized by an enzymes. So they will in this case betanicol, they are more resistant towards metabolism by cholinesterase. So they have actually an increased durations of activity lah. This is why they are drug of choice to be used as a cholinergic action drugs. The pharmacology effects of betanicol is actually they are used when you want to increase esophageal peristalsis, okay, and lower the esophageal sphincter tone lah. Okay, to increase esophageal peristalsis and lower the esophageal sphincter tone. Okay, when you have a condition where, for example, there is a blockage of the esophagus, okay, after surgery, okay, in order to actually restart the system, okay, we'll need mechanical for that, they increase the peristalsis, the movement of the esophagus lah. Okay, it's also used to increase tone and peristaltic activity of the stomach and the intestine. Okay, they increase the tone, meaning that again, if you have another what you say surgery on this GI tract, actually improving the stomach and intestine, so they use Utanicol to actually increase the tone and also the activity, the stomach and the GI tract. Okay, they will also increase gastric and pancreatic secretion. Okay, so again, gastric secretion such as the enzymes, so all these secretions actually helps in the absorption, also the pencernaan, what is called in English, digestion. Okay, digestion of feed and whatever. Okay, they use botanical to actually restart back the gastric and also the pancreatic secretion, like insulin and stuff like that. Okay, they also will actually increase the tone of the muscle in the bladder, and by that they will actually decrease the bladder capacity lah. So, for example, if your animal is actually having difficulty in urinating, okay, you can usually use botanical to actually increase the tone of the muscles of the bladder, and subsequently you will actually empty the bladder lah. Okay, they will actually urinate normally as before lah. Okay. So the kinetics of botanical, okay, they are actually if actually given orally, they will actually have a much slower absorption. So if you want to actually to use it to have a much faster absorption, either give it through subcut lah. Okay, it will have a much more faster or higher absorption lah. Okay, and by giving through subcutaneous administration, okay, the effects of botanical will much more be enhanced lah. Okay, because when you give subcutaneously, okay, they will actually bypass, okay, the functions of the stomach acid and whatever, so that much more drugs are available lah to actually produce much more enhanced effects. Okay, all right. If there are actually some contraindications of using botanical. You know what's contraindications? Meaning that if the animal has actually some predisposing condition, okay, you cannot use this drug because actually we exacerbate lah the condition the animal is having lah. Okay, so for example, contraindications of using botanical. Okay, when you have an urinary outflow, resistance, okay, is increased lah. For example, if you have example muscle injury whatever in the bladder, okay, not because of blockage, blockage is still a mechanical, right? It's not a mechanical obstruction. It actually occur when you have something to do with the physiology, okay, of the bladder. Okay, for example, you have outflow resistance due to the muscular, damage or whatever. So you cannot use botanical because it will actually further reduce the outflow of the urine lah. Okay, so they will actually exacerbate the outflow resistance of the urinary bladder. Okay, the adverse effects of botanical, not side effect, the adverse effects. Okay, adverse effects are actually quite mild. Okay, it includes like vomiting, okay, diarrhea, yes, salivation, okay, and also anorexia lah. Okay, there are some of the adverse effects lah. Okay, for example, if anorexia, more towards prolonged use of botanical. Okay, they also have some cardiovascular and also respiratory effects. Okay, if it's given through subcutaneous, okay, overdose of or high dose of botanical, you have some cardiovascular and also respiratory effects. Okay, and normally if you have that kind of adverse effects, if, for example, if you given this drug to an animal and this animal start showing these adverse effects, okay, you actually can counter these effects by using anti-cholinergic drugs lah. Okay, later on we can actually go to the anti-cholinergic drugs. Okay. Alright. For example, interaction of drugs. Okay. Another contraindication is that if you use this drug together with the other cholinergic drugs lah. For example, you use betanicol together, for example, with methylbromide. Okay, it can cause an additive effect lah. Okay, additive, and also can also develop toxicity lah. Meaning that you have much more of this cholinergic drug in the system, you will actually develop addictive effects and also toxicity lah. Okay, alright, that's for betanicol. Okay, for the second drug, is actually used as a cholinergic drug is metoclopramide. Okay, metoclopramide is used to stimulate the motility of the upper GI tract. Okay, like the esophagus, stomach, and duodenum. They are all this upper GI tract. Okay, and they have minimal motility effects on the lower GI tract. Okay, such as colon, what else? The rectum. They are all, if you use metoclopramide, much more motility is much more higher in upper GI tract compared to the lower GI tract. Okay, they will actually increase the peristalsis of the small intestine, okay, and increase tone and strength of contraction in the stomach lah. When you have an increased peristalsis of the stomach, small intestine, and increased tone and strength of contraction in the stomach lah. Okay, and also cause relaxations of the pyloric sphincter. Right. The third effects of metoclopramide is actually act as a central emetic drug. Central anti-emetic drugs. So they are used to actually stop animal from vomiting. Okay. Act as a central anti-emetic. Central meaning actually action on the brain. Okay. Blocking the uptake of dopamine at the chemoreceptor trigger zone lah. Okay, they block the uptake of dopamine at the chemoreceptor trigger zone. Okay, subsequently will actually prevent the animal from vomiting. Okay, they are kinetically the pharmacokinetics of metoclopramide is that they are absorbed well lah, even if it's given orally. Okay. So again, metoclopramide they can penetrate the CNS, okay, and also they can also cross the placenta, okay, and also they can actually go towards the mammary gland lah, of the pregnant animals lah. Okay, so they can actually be traced inside placenta and also milk of animals lah. Okay, so if animal is actually used for dairy animals lah. Okay, so make sure if you want to use this drug, you have to actually check what's the withdrawal period before the milk can be can be sold or whatever lah. Okay, alright. Side effects lah. Okay, side effects of metoclopramide, they will actually cause rare CNS side effects such as sedation. Okay. For cats, okay, they will actually cause hyperactivity or disorientation. Okay, and if it's given in a very high dose or overdose in dogs and cats, they will actually cause some sort of toxicity lah, neurotoxicity lah. Okay, for example, if you see a dog suddenly developing ataxia, failure to coordinate their movement, something to do with increase or overdose of metoclopramide lah. Okay, if this thing happens, okay, normally we'll actually counter with the use of an anticholinergic drugs lah. Okay, alright. Whether I can open your table or not. Okay, if you actually remember, if you ask your senior, one of the things actually me has is actually this table lah. So like for example, if the test is tomorrow and you don't have time to actually read the whole, you can actually use the table lah as your reference lah. Okay, this is how the effect of chronic drugs on each body tissue lah, on the cardiovascular, what does it does, okay, on the lung, especially on the bronchi, on the GI tract, okay, on the urinary, on the ocular, okay, on the skeletal muscles, okay, so on the glandular organs lah, what does this on cholinergic drugs does lah. Okay, it's from the table I think you can get from 12 I think I already uploaded this. Okay, so any questions? Cholinergic drugs? Okay, tak ada, we can move to the next one, especially the anti-cholinergic drugs. Anti meaning that the opposites of cholinergic drugs lah. How does an anti-cholinergic drugs work? It's actually by inhibiting the actions of acetylcholine, okay, by occupying the acetylcholine receptors lah. Okay, imagine this guy, anti drugs, someone is actually and bus lah, dalam bus lah, for example. You want to sit at this seat, okay, so somebody actually occupy the seats first. And you cannot actually sit. What happens to you? You become mad lah kan? Something like that lah. So they occupy the acetylcholine receptors lah. Okay, so they prohibit the acetylcholine to attach on the receptors so that it cannot work the actions lah. Okay, examples of acetylcholine, example of anticholinergic receptors drugs we have is actually atropine, glycopyrrolate, aminopentamide, and propantolene. Okay, the most commonly used is actually the atropine lah. Okay, until the extent that the atropine is the only drug that actually used as an anticholinergic drugs lah. Okay, we don't have to, although the other drug have the other effects, but atropine itself actually has a very good response and very good usage, so we stick with that lah. Okay, as a teaching hospital, for example, in the faculty, okay, it's good to have all these drugs in the pharmacy for you to actually learn, okay, and also this. But later on, when you practicing, okay, have your own practice or whatever, don't actually have to have all these drugs lah, because they have all the same effects. They just use one lah. If the one is actually is useful and also they don't have any issues using it, so you just continue using it instead of having so much drugs in your pharmacy or whatever. Okay, so atropine is actually is the most common. Okay, as atropine, they are highly soluble in water. Okay, the cholinergic receptors, okay, acetylcholine receptors, they have two types. They have the M cholinergic receptor and also they have the N cholinergic receptors lah. So the atropine actually they block the M cholinergic receptors lah. Okay, they actually occupy the M cholinergic receptors. Okay. So on the smooth muscle, okay, what does the pharmacology effects of atropine is that they will actually cause relaxations of the visceral smooth muscle, controlled by cholinergic receptors, and remove muscle spasm lah. Okay, that's the functions of anticholinergic drugs on the smooth muscle. Cause relaxations of the visceral smooth muscle, controlled by cholinergic receptors, and remove muscle spasm. Okay. On the eye, actually, it will actually produces mydriasis, okay, by relaxing the pupil sphincter lah. Okay, what is mydriasis? Jadi the dilation of the pupil lah. Okay, on the glandular organs, they will actually inhibit the excretion of many kind of glandular organ secretion. Okay, if they actually act on the salivary gland, they reduce the production of saliva. Okay, they will actually reduce bronchial glands secretion, gastrointestinal gland, okay, and they will actually cause patient will have dry mouth lah because of less of saliva production. And if the animal is having some sort of flu-like symptoms, okay, they have a lot of mucus occupying the airway, Okay, by using atropine, they will actually prevent the airway obstruction by reducing the amount of secretions on that particular area. Okay, on the cardiovascular system, they will actually increase the heart rate. Okay, increase the heart rate. Okay, by blocking the effects of the vagal nerve activity lah. Okay, actually you have the cranial nerves, the vagus nerve is number one in the cranial nerve, vagus nerve. Anyone else? Number 10. Yes, vagus nerve is the number 10 lah. Still remember lah, 1 until 12, vagus nerve. Sorry, cranial nerve.
Yes.
What's number 1? What's number 1? Cranial nerve. Number 1.
Factory.
Olfactory? Sure.
Yes.
Come on, you guys. Trigeminal is not number what?
5.
Trigeminal. Number 5. Trigeminal. Betul. Okay. You must remember your cranial nerve is important. Later on, when you go to your clinical subject, clinical skill or whatever, testing, physical examination on nervous system sign, you guys must remember. Later on, they will actually say, okay, if the animal is having this symptom, what cranial nerve is actually affected? Say trigeminal. Okay, trigeminal nerve. What number what? All these things are actually very important to remember your cranial nerves. Okay, so it actually increase the heart rate and also the conduction velocity lah. Okay, if we have a face-to-face lecture, I can actually show you what is the conduction velocity lah. Tapi how I'm going to imagine lah. You know that the ECG, the echocardiogram, you know this thing like beep, 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 kan? Okay, conduction velocity actually the QRST wave. They have some actually when you have you using anticholinergic drugs, they will actually increase the PQR wave, and then they will actually increase so that they will increase the heart rate at the same time lah. That's the conduction velocity. Okay, atropine can actually they are used because to reduce or to revert the sinus bradycardia lah. So that if we have the animal actually have sinus bradycardia, I mean the heart rate is quite slow. So you give atropine, it will actually increase the rhythm lah, and also we increase the heart rate lah. Alright. So atropine is the pharmacokinetics, they are well absorbed also after oral administration. Okay, so IM injection, okay, inhalation, and also endotracheal administration lah. So you can choose lah if you want to give whatever route you prefer. Okay, they are actually well absorbed lah, even if you use oral, IM, inhalation, or also endotracheal administration. You know what's endotracheal administration? Okay, you use endotracheal tube to deliver the drugs directly to the, for example, if you go to the lungs, for example, you can actually give it directly lah using the endotracheal tubing lah. Okay, they are well distributed throughout the body. Okay, they are well distributed throughout the body and crosses into the CNS. They can actually cross the central nervous system area. Okay, they can actually cross the placenta. Okay, and also cross the mammary gland. Okay, then distributed into the milk lah. Okay, so atropine is metabolized in the liver. Okay, and excreted into the urine lah. So metabolized by the liver. Okay, so 30 to 50% okay, of the dose excreted into the urine is unchanged lah. For example, when they actually metabolize in the liver, 50% will be actually converted to their secondary metabolites to be used by the body. So another 50 they're not going to actually change lah the structure, everything. The metabolites of the atropine is still the same. Okay, so what this tells you is that if you want to give atropine, you cannot give the atropine, for example, you calculate the atropine like 100 milligram, for example. You say that, okay, 50% is actually unchanged in the liver. Okay, so why don't you give only 50? The thing is, when you give 50, the requirement, for example, is 100. So like 50% of it or become 25% only actually used. So the animal will actually underdose. Okay. So excreted unchanged doesn't mean that you want to reduce the effect. Okay, you want to reduce the dose. Okay, and unchanged meaning that the requirement is that they only can have changes into the into secondary metabolites required by the body to be used. Okay, to have a maximum or optimal effects. Okay, so half-life of atropine is 2 to 3 hours lah. Okay, if you can actually uh, design lah, what is the dosage interval lah. You know the half-life of these drugs lah. It's 2 to 3 hours lah. Okay, contraindications of atropine. Okay, they cannot be used for patients with glaucoma. You know what's glaucoma? Tahu glaucoma tak? Anybody knows what glaucoma is? Something to do with the eye?
Yes.
I ada 110 student, Mira je yang selalu respond. Rest of you apa? Tak dengar? Okay, we have Pravina saying that the increase on intraocular pressure lah. If you have intraocular pressure, okay, will actually cause glaucoma lah. Okay. Why is that integrated in the patients with glaucoma? Okay, when you have a glaucoma, the pressure is actually very high. So if you give this drug, they actually increase much more pressure. Okay, we have an increased heart rate, we increase blood pressure. What happened to the eye? Okay, they will actually, the retinal, okay, where the retina or the cornea can actually luxated lah because of increased pressure in the eyeball lah. Okay. Alright, they cannot be used for patients with GI obstructive disease. For example, a cat actually swallowed rambutan seed or durian seed or whatever. So there will be some sort of obstructive disease, obstruction. Okay, so don't use it because when they must increase in the muscular tone, whatever, they will actually cause the tear of the muscle lah, damage the muscle lah because of increased pressure lah. Okay, push the blockage out lah from the GI tract. Okay, they will also cause important indication in patients with myocardial ischemia lah. Meaning that if you have a blockage lah, ischemia of the muscles in the heart, the myocardium is the muscles of the heart. Okay, they are contraindicated lah. Okay. So clinical use of atropine. Okay, atropine, the clinical use is actually first is to be used as a pre-anesthetic drug to prevent or reduce secretions of the respiratory tract. Okay, for example, if you want to actually insert the endotracheal tubing, okay, before you want to give the inhalation anesthesia to the animals, you want to make sure the area where the trachea is clear from any obstructions or any mucus or whatever, you use atropine, okay, to clear off the respiratory tract. The second clinical use is actually to treat sinus bradycardia. Okay. Third clinical use as an antidote for overdose of cholinergic agents, okay, like organophosphate poisoning, okay, like I said just now, the soldier, okay, comebacks from Vietnam War, okay, they are using atropine as an antidote lah to reverse effects of cholinergic agents. Okay, number 4, they are used as an antidote. They are used to treat hyperthyroidism lah. Yeah, what's hyperthyroidism lah? Spelling is actually HYPRASIALISM. What's hyperthyroidism? Bukan the guy is to sial Okay, so hyperthyroidism is actually when you have a lot of saliva production lah. example lah, if somebody, the guys lah, boys lah, normally tengok perempuan kan biasa you have hyperstylism kan, highly meleleh kan. So give atropine lah, actually to reduce lah the production of saliva lah when seeing ni lah perempuan lah. Okay, girls lah. Alright. And number 5 is actually to be used as a treatment for bronchoconstrictive disease lah. Okay, when you have for example asthmatic or COPD COPD patients, okay, they have a lot of mucus production, as on the bronchus, so they are given atropine to actually reduce the situation and also to treat the disease lah. Okay, that's for atropine. All right. Okay, any question? Drugs. Okay.
Doktor,
Yes, Mira.
because you were saying macam apa 30 to 50% you expected kan, and then kalau bagi 100 versus 60 versus 25, I think that part betul ke betul tak?
Cannot hear you lah, Mira, you tersekat-sekat.
Tak,
Okay.
tak apa, I kena chat.
Okay, I think you just message me. Okay. Alright. I think Mira, what Mira mean is that I can catch lah a bit from the stuttering lah, dia punya internet tu tak clear. Okay, if you want to say 30 to 50% unchanged, right, in the urine kan. Okay, if you calculate the dose is actually 100. You say that okay, 50% is unchanged. Why don't you give only 50 so that you can still actually have the effects, but you don't compromise on the dose. Okay, the thing is that although it's actually unchanged in the urine, unchanged doesn't mean that when it's unchanged it doesn't have any effects. Okay, when you actually metabolize by the liver, okay, the atropine, they have direct effects. Okay, this the one that actually enters the body have a direct effect together with the one actually being metabolized by the liver and produces secondary metabolites. Both the first and the secondary metabolites from the metabolization of atropine in the liver is actually work to produce an effects on the animals or the patients. Okay, so that the unchanged in the liver mean that they are not metabolized, but they actually did their work lah to have effects on the animals or the patients lah. That's what I mean by the unchanged in the liver. Okay, so this is the effects of the anticholinergic drug, the table. Okay, on the cardiovascular, the lung, intestinal, urinary, ocular, CNS, and also the glandular organs lah. This is some of the table I like to put inside test lah. Normally I have the table, nanti I kosongkan belah belakang ni, maybe on the right side. So you have to fill up whatever effect they have on this. That's one catch, Masa I mula-mula when I start actually teaching pharmacology and actually give test lah. Normally I don't change the sequence lah. Okay, whatever I put there in the test paper lah. So on the second or after that lah, so when I change the sequence lah, macam cardiovascular, I go all the way down kan. But student yang kadang-kadang you guys actually they tend to actually memorize tau. They memorize the whole table so that they know, okay, the location of this word should be on the first, on the most top. So nanti dia terabur lah. That's another thing that if you read notes or test or whatever, and make sure you understand, okay, read and understand. Okay, doesn't read just to actually memorize. Okay, if you memorize, you cannot actually understand whatever you are studying. Okay, pesanan khidmat masyarakat lah, from me lah. Okay, ini macam Dr. Isham pula bagi masyarakat, bagi nasihat lah petang-petang. Okay, so no question, anticholinergic drug. Okay, we move to the adrenergic drugs lah. Okay, adrenergic drug is actually to stimulate the action of the sympathetic nervous system lah. Okay, stimulate the actions of sympathetic nervous system. Okay, examples of drugs that act as an adrenergic drugs. We have epinephrine, norepinephrine, isoproterenol, dopamine, dopamine, phenylpropanolone, azoethylene, albuterol, terbutaline, ephedrine, and xylazine. Okay, you can remember or not all this drug? Susah kan nak remember kan? So what I do is that you just remember the most commonly used drug as a adrenergic drugs lah. Okay, the most commonly used is actually xylazine lah. Okay, xylazine is the most common adrenergic drug used. Okay. Okay, the adrenergic receptors, they have two types. They have the alpha receptors, and also they have the beta receptors. Okay, alpha and also beta receptors. Okay. So, what are the clinical use of adrenergic drugs? For example, like xylazine. Okay, the first use of xylazine is actually used as a bronchodilators. Okay. So they are used as a bronchodilators to treat asthma, bronchial asthma. Okay. Okay, how does they actually produce effects? Actually by attaching itself to the beta receptors, okay, to relax the smooth muscle lah. Okay, you attach itself to the beta receptors to relax the smooth muscle lah, and also when we cause bronchodilations lah. Okay, they will actually also attach themselves to the alpha receptors, okay, and constrict the bronchial mucosa and reduce secretions lah. Right. The second clinical use of xylazine as an adrenergic drug is actually as a nasal decongestants and vasopressors. Okay, that's nasal decongestants and vasopressors. Okay. So when you have congestions in the respiratory tract, it is caused by the swelling of blood vessels, okay, of the mucous membrane. Okay, swelling of the blood vessels of the mucous membrane of the nasal passages. Okay, this will actually cause nasal discharge and obstruction. Okay. What does this drug do is that they will actually shrink, okay, and reduce the size of these swollen nasal membranes lah in the blood vessels. Okay. Decongestants, okay, can be either be given topically, okay, as drops lah, okay, or by inhalants, or they can also be orally ingested lah. Okay. Okay, the effects can actually last up to 4 hours lah if using the drug as a decongestant. Right. And the third use of adrenergic drug is actually as a cardiac activation lah. Okay. In this case, you use epinephrine. Epinephrine, okay, can be injected directly into the heart, okay, to stimulate it after itself stop beating, okay, due to drowning. For example, if you have drowning patients, a suffocation, a shock, electrocution, and anesthesia lah. For example, anesthesia, you use epinephrine lah. Okay, if you know paramedic, know paramedic, not the movie on Netflix, paramedic, the paramedic, the actual occupation lah. Okay, one of the thing that is very, very important to have in their actually first aid kit is actually an epinephrine syringes lah. So, for example, if they actually tend to cases lah where we have a trauma, accidents, and the patient is not breathing, so the heart is stop. So they use epinephrine directly to the heart, injected so that it will restart the heart lah. Have you pernah tengok kan when you have patients heart attack, cardiac arrest, they use this defibrillator lah, like 1, 2, 3 clear kan, defibrillator. Sometimes you see before they use defibrillator, they actually inject the patients first with epinephrine before they use the defibrillator to ignite or restart the heart. Okay. Right? Epinephrine, one thing good about to be used as a cardiac activation because they dramatically restores the heartbeat. They actually is quite fast, quite rapid. Okay. In cases of shock, okay, norepinephrine has been used to restore and maintain sufficient blood pressure and ensure adequate blood flow to vital organs. Okay. In cases of shock, norepinephrine has been used to restore and maintain sufficient blood pressure and ensure adequate blood flow to the vital organs. Okay. For example, if you have hypovolemic shock, loss of blood, okay, sometimes vital organs such as kidney, brain, liver, they are vital organs. So they actually they will have a reduced flow of blood to the area because of blood loss. So you give norepinephrine to actually maintain an adequate blood flow to the vital organs lah. Okay, so that they will actually this patient doesn't actually suffer from multiple organ failure lah. Okay. Alright, that's for adrenergic drug. Okay, any question? It's quite simple lah, quite straightforward lah. Okay, so I show you the effects of adrenergic and adrenergic blocking agents that I combine lah both of these drugs into one table. Okay, adrenergic drug effects. Okay, alpha 1, they will actually increase force of contraction. Okay, the opposite effect actually cause vasodilation and meiosis if the drugs works on the alpha 1 receptor. Okay, alpha 2, they inhibit norepinephrine and dilate blood vessels, producing hypertension. There's a question, CC, allergic blocking drug effect, there's none. Let's say if you want to reverse the effects of adrenergic drug on the alpha 2 receptor. You said that if you give the drug, it doesn't have produce any effect. What should you do? What should you do? Anybody knows what should you do? There's no effects of adrenergic blocking drug on an alpha 2 receptor to reverse any to reduce back, to constrict back the blood vessels, to increase the hypertension. What should you do? Anybody knows? You should actually go for alternative drug. Okay, doesn't mean it has to be an adrenergic blocking agent. You can use other type of drug, okay, that can actually reverse the effects of inhibit release of norepinephrine, dilate blood vessels, hypertension. So there, you can use an alternative or other drug, substitute drug that can actually have that kind of effects. Okay. So for beta 1, they have increased heart rate and force of contraction. By using adrenergic blocking drug effect, they will actually give the heart rate the opposite lah. And for beta 2, they will dilate bronchioles and relax gastrointestinal tract. Okay, if you use a beta 2 blockers, they will actually constrict the bronchioles lah. Ada opposite effects lah. Okay. I think that's all good. Any question lah? Wah, quite short lah hari ni lecture. Any question? So from Friday test, macam mana test korang lah? Essay lah? Essay? Essay or MCQ? MCQ? Oh, MCQ. MCQ, how MCQ online boleh ah?
Boleh doktor kita.
Oh, Putra Blast.
Google Form doktor.
Google Form. Oh, Google Form. Oh, live Google Form lah, meaning that when you fill out everything ni lah. Okay, understand. Second test bila lah Pharmaco lah, I tak tahulah I nak buat macam mana test lah. What actually suits you guys lah? Yang senang for you guys?
MCQ doktor.
No test.
I know the answer already. MC no test. Oh. We see lah how it goes lah. Maybe we can do what? Maybe you can just give me assignments ke apa ke kan. Easier that way lah kan. Open book test ke kan. Because MCQ I think susah lah I nak. Most of the time test ni depends on the connection internet lah kan. Sometimes suddenly your internet connection interrupted, susah pula nak buat test kan. Tak pula jawab soalan ke apa kan. But lah, thank God my test is on mine is the second test, so I want to see lah how the Tariqah will do for her test lah, macam mana. Tengok macam mana lain we can do lah. Okay. So any question? Before that, normally if you go drugs that you use as an energetic blocking drugs, they are called as made by their name lah, beta blockers, or also they have alpha blocker and also beta blockers lah. Okay. Sometimes people don't know. If you go, I want to use energetic antagonist drug. Itulah. Contohnya tu kan. So if you want to, normally they are known as either beta blockers and also alpha blockers lah. So the beta blockers normally, the alpha blockers normally known drugs actually. Yeah, senang lah. Alpha blockers, all these ibuprofen, prazosin, and also yohimbine lah. So you remember lah. So the beta blockers senang lah, yang all this LOL lah, LOL, propanolol, metoprolol, timolol kan ada LOL kan dalam emoji tu kan, LOL macam itulah. So easy to remember lah. Beta blockers, propanolol, metoprolol, and timolol lah. Okay, alright. If next no questions, okay, thank you very much. Okay, good luck for your test. I think yesterday I dah bagi, Mira dah bagi belum Mira?
Doktor,
The list tu. Yes, Siti Nurliana.
Mira tanya,
Tak dengar apa?
Mira tanya soalan.
Saya soalan?
Doctor, I sent something in the chat box.
Ada Allah. Kejap. Mana chatbox ni? Okay, I'm sorry, I don't understand if the drug is unchanged from drug that job. We can use other drugs together with energetic drugs. Okay. Can you use other drug together with other energetic drugs? Okay, you have to look the drug itself. Most of the energetic drug, they are quite potent lah. Okay, so that the use itself is sufficient enough to have the effect that you want lah. Okay, so, if you want to combine with other drugs, meaning that what you want to use two types of energy drug at the same time, is it? Or you take use energy drug with maybe antibiotics ke, other type of drug ke macam itu ke apa? So the question is that those two options. Okay, if energy drugs, okay, you can only use once lah. Okay, only one lah. It is at one time, because as I said just now, the effect itself is quite potent lah. So instead of actually you put more drugs with the same effects on the animals, okay, just use one lah. Okay. The second question, can you still use other drugs, energy drug together with other types of drugs that actually have different functions lah? The thing is you can, because technically this drug actually have their effects on specific action, and the other drug have a specific thing of specific action, doesn't actually contravene their effects together lah. I also give another example. I think later on Dr. Arifah will have a lecture on anti-inflammatory and NSAIDs. There's a reason why you cannot give two NSAIDs at the same time. Okay, because once that they have the same effect, and secondly, if you give two at the same time, and they will actually, the effect will actually be enhanced, and you will have an adverse effect later on. That kind of things lah. Okay, all right. Okay, so I think I will see you guys on Thursday lah for the BPD Info 970 lah. I think Mira already sent right the link kan? Dah Mira? Okay, so make sure at on Thursday we start at 9 sharp. Okay, those names please make sure you actually log in to the correct link lah for your facilitators lah. Okay, later on the facilitator will actually brief you a bit about how do you run a PBL, the scribe, the chairman, the secretary, and all those stuff lah. They will actually brief you a bit, and they will actually brief you about the use of filler table, stuff like that. And make sure during your session, I want you to actually switch on your video lah, so that we want to see the interactions lah, not just audio interaction. We also have some type of video interactions together lah. Okay, it's actually for us facilitators to actually assess also lah, because we have a criteria for assessment for the PBL lah. So one of it is actually we have to see lah your body language and stuff like that lah. Okay. Okay, any question? If not, okay, thank you very much. I see you guys on Thursday. Nanti you straight away at 9, straight away go to your link to your PC lah. Nanti I will jump lah from link to link lah to actually see everyone lah. Okay, alright. If not, thank you very much. See you on Thursday. Assalamualaikum. Good morning.
Thank you.